Hi everyone, this is Dr. Heather Austin Robillard, and this lecture is going to be over bulimia nervosa. Individuals with bulimia nervosa engage in disordered eating behaviors that put them at great health risk, yet they continue to engage in these behaviors despite recognition that they are endangering themselves. Bulimia nervosa is associated with an out-of-control eating behavior or binge eating, which is then followed by the use of some form of compensatory behavior. A compensatory behavior is something like vomiting, laxatives, or overexercise. In this module, you will learn about the warning signs, symptoms, diagnostic criteria, and health risks for those who are diagnosed with bulimia nervosa. First, we're going to go over the prevalence rates of bulimia nervosa in the United States. Research shows that we have 1.5% of U.S. females and 0.5% of males struggle with bulimia nervosa. Bulimia nervosa affects 1 to 2% of adolescents and young adult women, with the average age of onset being 18 years old. Bulimia nervosa, or BN, has been documented to affect individuals as young as 9 years of age and adults into their 40s or even older. People who struggle with bulimia nervosa usually appear to be an average body weight, unlike those with anorexia nervosa who appear to be underweight. Many people struggling with bulimia nervosa recognize that the behaviors are unusual and present dangerous risks to their health. BN is frequently associated with symptoms of depression or social adjustment. In fact, 85 to 95% of individuals who struggle with bulimia also are diagnosed with another mental health disorder. The risk of death from suicide or medical complications is markedly increased in those who struggle with eating disorders in general and specifically with bulimia nervosa. One of the main symptoms of BN is out-of-control eating, often referred to as a binge. Binge eating is described as eating larger quantities of food in a shorter amount of time than is normally considered a normal meal. After engaging in this binging behavior, individuals report feeling guilty and ashamed. They may see this as a sign of failure or an inability to keep control over their weight and body. Sometimes BN individuals consider themselves to be failed anorexics because they typically put very strict and rigid rules around their eating behaviors. But the rules are so strict that they cannot be maintained and result in engaging in a binge behavior. This guilt and shame may result in feeling panicked about the amount of food they just consumed and leads to these compensatory behaviors like vomiting as drastic measures to undo their overeating. These individuals typically report feeling very out of control. Their self-esteem is overly related to their body image, so much so that they report feeling preoccupied with their body shape and weight, and they often live in fear of gaining weight. They feel out of control in relation to their eating behaviors. Bulimia nervosa is one of the eating disorders that is recognized in the DSM-5 as a full threshold eating disorder. The criteria that are noted for the DSM-5 in order to be diagnosed with bulimia nervosa include recurrent episodes of binge eating in a discrete period of time, an amount of food that is definitely larger than most people would eat during a similar period of time. They have a sense of lack of control over their eating during these episodes. And B, there's a recurrent inappropriate compensatory behavior in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, or other medications, even fasting or overexercise. These need to occur at least once a week for 3 months. Their self-evaluation is unduly influenced by their body shape and weight. And the last criteria is their disturbance does not occur exclusively during episodes of anorexia nervosa. Under bulimia nervosa, there are 2 different subtypes. The first is the purging subtype. This occurs when a person regularly induces vomiting or misuses laxatives, enemas, or diuretics to compensate for their episodes of binging. The non-purging subtype occurs when a person engages in regular fasting or excessive exercise, but does not demonstrate purging behaviors such as vomiting or misusing laxatives. When you're diagnosing a patient with bulimia nervosa, it's important to specify if they are in partial or full remission. Partial remission is after the full criteria for BN were previously met, but not all criteria have been met for a sustained period of time. Full remission is after the full criteria for BN were previously met, but none of the criteria have been met for a sustained period of time. In the DSM-5, there's also criteria for severity level of the eating disorder. The minimum level of severity is based on the frequency of inappropriate compensatory behaviors. The level of severity may be increased to reflect other symptoms and the degree of functional disability. Mild would be considered for somebody who has an average of 1 to 3 episodes of compensatory behaviors per week. Moderate is where they experience 4 to 7 episodes of compensatory behaviors per week. Severe would be 8 to 13 episodes, and extreme would be 14 or more episodes per week. So what are the warning signs for someone who might be struggling with bulimia nervosa? There is evidence of binge eating, such as disappearance of large amounts of food in a short period of time. You may find wrappers or containers indicating the consumption of large amounts of food. There also needs to be an evidence of purging behaviors, frequent trips to the bathroom after meals, signs or maybe smells of vomiting. There may be the presence of wrappers or packages for laxatives and diuretics. There may also be an excessive or rigid exercise regimen. Despite weather, fatigue, illness, or injury, they feel the compulsive need to burn off the calories they've taken in. There can be an unusual swelling of the cheeks or jaw area, calluses on the back of their hands and knuckles from their self-induced vomiting, discoloration of their teeth, maybe a staining of their teeth, the creation of lifestyle schedules or rituals to make time for their binge and purging cycles. They may withdraw from usual friends and activities. In general, their behaviors and attitudes indicate that weight loss, dieting, and control of food are becoming their primary concerns. And there's continued exercise despite injury or overuse injuries. As with anorexia nervosa, there are some obvious health complications due to one starving themselves. But there are actually some very serious health complications when it comes to bulimia nervosa as well. These health concerns can often get overlooked because people who struggle with bulimia nervosa are often not underweight or are an average weight. The first health consequence from bulimia nervosa is usually dehydration. The compensatory behaviors, whether it's vomiting or use of laxatives and diuretics, typically leads to dehydration. It can show up in dry skin, weak muscles, and fatigue. It can also lead to hypertension or high blood pressure. The other common consequence is electrolyte imbalances. Vomiting or the use of diuretics throws off an individual's electrolyte balance. So why do we need electrolytes? What do? These regulate nerve and muscle functions, help with hydration of the body, and keep blood pH levels balanced and repair damaged tissue. Issues with imbalances can cause a risk for hypokalemia, which is a low potassium level. Hypokalemia can lead to cramps, weak muscles, constipation, and possibly rhabdomyolysis. Bulimia nervosa can also lead to an irregular heartbeat and possibly heart failure and death. Chronic vomiting also creates issues particularly in the digestive tract. In the mouth, the high acid content of vomit damages one's teeth, causing enamel erosion, tooth sensitivity, and gum disease. It creates the appearance of a puffy or swollen cheek due to inflamed salivary glands. Excessive vomiting creates a sore throat, and an extreme high acid level in vomit can irritate or tear the esophagus. If a client reports blood in their vomit, this is a warning sign that they have an esophageal tear. The overuse of laxatives can make it difficult to have bowel movements without the use of this medicine, which creates constipation. Misguided use of laxatives can cause kidney damage. Damage to the intestines can cause bloating, diarrhea, or constipation, and straining of the bowel movements can cause hemorrhoids. Bulimia nervosa can also lower your blood pressure, weak pulse, and even create anemia or low iron levels within your system. Bulimia nervosa is also commonly interfering with menstrual cycles or can stop them altogether. It creates a hormone imbalance that tends to fatigue or stop our sex drive. Ovaries may cease to produce eggs or making one infertile. It can create stomach or intestinal ulcers, and it also is associated with osteoporosis, which can lead to human bones becoming extremely fragile and easy to fracture. The following signals recurrent self-induced vomiting: calluses on their hands or thumbs, abrasions on their hands or thumb, or bruises there. These are referred to as Russell's sign. They develop due to repeated contact with incisor teeth during the act of induced vomiting. Not all individuals who purge due to BN diagnosis will have dental problems. Is one of the first areas that people might be diagnosed with bulimia nervosa because it creates major damage and tooth decay or erosion. While most eating disorders occur lower in males, bulimia nervosa is no different. There is little research on the clinical representations or etiology of bulimia nervosa in males. What we do know is there's a difference in compensatory behaviors, with men primarily using excessive exercise. There is more research on gay males struggling with bulimia nervosa versus heterosexual males, showing that 8 to 15% of males with bulimia are gay, whereas 1 to 5% of bulimia in males are heterosexual. There are also ethnic differences between eating disorders. While eating disorders do not discriminate based on race and ethnicity, there is still a little bit of research on some of the ethnic differences. Some research indicate that non-whites are less likely to have bulimia nervosa, while other studies indicate that there are similar rates among women of all ethnicities. There's even research that show that Black teenagers are 50% more likely to exhibit binging and purging behaviors than white teenagers. And another study shows that Hispanic women are significantly more likely to struggle with bulimia nervosa than non-Hispanic peers. Again, this shows the need for more research to be conducted so we can better understand how bulimia nervosa may present or impact different groups. In this module, you learned about bulimia nervosa, which impacts 1 to 2% of the population, with the predominant amount of those being females in their late teens. Individuals with bulimia nervosa have episodes of binge eating or eating more food than typical in a period of time, which could cause physical discomfort and then engaging in compensatory behaviors such as throwing up or diuretics. These behaviors can result in extremely negative consequences on their health. I hope you've learned a lot about bulimia nervosa, and I look forward to talking more with you about some of the other eating and feeding disorders.